नमस्ते डाक्टर बेन। आज जनता र स्वास्थ्य कार्यक्रममा डाक्टर के राईसँग दुईजना डाक्टर हुनुहुन्छ। एकजना डाक्टर हुनुहुन्छ जापानबाट आउनुभएको डाक्टर शिन्जी किमुरा र एकजना नेपाली डाक्टर हुन्छ युवा डाक्टर विश्व दवाडी। हामी दुवै डाक्टर साहबहरुलाई यहाँ स्वागत गर्न चाहन्छौं। वेलकम डाक्टर शिन्जी हियर इन नेपाल।
थ्यांक यू।
And डाक्टर साहबलाई पनि यहाँ स्वागत छ।
नमस्कार।
So today we'll talk about the role of primary care physician. What's like in Japan? What's the service like in Japan? We'll share with you about the primary care physician's role in Japan, so we can learn from you what we can do in Nepal also. And we'll also talk a little bit of the role of primary care physician in Nepal. So both of you are the primary care specialists, primary care physicians, and in primary care physician's role is most crucial, most important in terms of saving lives, in terms of the emergency situation, disaster like we had last few months ago in Nepal, devastating earthquake disaster. So and in Japan also we had tsunami disaster a few years ago, so we can share your experience. And then with Dr. Dawadiसँग पनि हामी यही कुरा गर्नेछौँ कि प्राइमेरी फिजिशियन्सहरूको एमडिजिपी नेपालमा भनिन्छ एमडिजिपी को रोल चाहिँ नि कस्तो हुनुपर्छ, कस्तो छ, गभर्नमेन्टले यसलाई प्राथमिकतामा राखेको छ छैन, र एमडिजिपीहरू खास गरिकन युवा एमडिजिपीहरू जिल्लामा जाने परिस्थिति छ छैन, यो बारेमा हामी छलफल गर्नेछौँ। र सबभन्दा अगाडि I would like to request Dr. Shinji to talk briefly about the role of primary care physician in Japan, what you do in Japan. Dr. Shinji, please share your roles, responsibility.
In Japan, as primary care doctors in Japan. In Japan, as in many countries, medical care is provided by doctors of many specialties, like internal medicine, surgery, orthopedics, pediatrics, things like that. Family medicine, general practice is still being developed, and primary care is not provided only by general practice doctors, family medicine doctors, but also by other doctors of other specialties as well. We hope that in the future most of the primary care will be provided by primary care doctors like family physicians or general practitioners, but we have yet to reach that point. So right now the primary care is sometimes provided by an internal medicine doctor around the corner, or by a pediatrician around the corner. Sometimes the internal medicine doctor may say that, well, I can take care of something else other than internal medicine problems, but he or she may or may not have had such training in other areas, and that's being problematic. And we as family physicians see it as rather problematic. In Japan, as Japan Primary Care Association, we are trying our best to train family practitioners, general practitioners of new generation, trained in all aspects of healthcare, seeing babies, adults, elderlies, taking care of their medical problems or surgical problems, minor surgical problems like they're having cuts and stuff like that. Also, we want to provide mental health problems. We also want to address preventative issues. We want to provide preventive medicine. We emphasize immunization. We also keep public health in mind, to try to keep the whole population as healthy for as long a period of time as possible. But in Japan, even in our country, primary care is still not getting enough attention. People seem to want to specialist care, but they don't realize that his or her problem may not be addressed best by the specialist he or she picks. Sometimes, or quite often, his or her problem or problems may be best cared for by family physicians, general practitioner, or primary care doctors who are trained to see all aspects of human health. And we are trying to emphasize that. So, in essence, we are still on our way to fully developed primary care provided by family physicians. We're trying our best.
So you are trained in USA as a family physician, right?
Yes.
So is there any difference between the system in Japan and the system in UK and USA?
In US, I wouldn't say very different. Well, in Japan, every citizen is under insurance. Every citizen has an insurance. In the United States, not very many people are under insurance. That's a big difference. But as far as specialties of doctors, even in the United States, some internal medicine doctors, internists, do provide primary care. Some pediatricians do provide primary care partly. Some orthopedists partly provide their primary care and things like that. So, in a sense, similar to what we are in Japan. Whereas in the United Kingdom or Canada, Australia, New Zealand, their primary care is being provided all of their primary care is provided by family physicians or general practitioners. So it's more integrated, I think.
Okay, thank you. And then let's go to Dr. Bisho Dawari. So I want to ask Dr. Bisho, what is the current context in Nepal in terms of the primary care? What is your experience? Can you share with us?
Yeah, our nation had a vision to, they have prioritized the primary healthcare services in Nepal. MDGP is the first PG program. It was started from the Tribhuvan University since early 80s. And probably you are one of the first or second batch who graduated as a general practitioner in Nepal. But sad to say that now the government is either not promoting or not encouraging new generation people to study these subjects. So for these things, nowadays the young generation, they are access to the so many technologies, and they run behind the opportunities. So to encourage those people, we have to encourage them, and there should be policies to upgrade this GP program in Nepal. I was eager. When I was young, I went to near to the Everest base camp and worked for us all 1 year.
You're still young though.
Yeah, thank you very much. So, but I'm not always to stay in that part of the world.
We have to consider the category of different health
place, but they are not agreed to stay. You need to come for the minor surgery of hernia from Jumla to Kathmandu. It is a waste of time, waste of money, waste of resources. So primary care service is really needed in Nepal, and we should always encourage our new graduate to study GP and serve for certain period of time in Nepal, and they should get something after that. They should get additional degrees, additional job opportunities, so that they are encouraged to stay in Nepal. If we won't do those things right now, then this brain drain will be a great problem for our Nepal.
Okay, so can you highlight what are the components, specifically component that the primary physician or MDGP can provide in terms of health services? Let's say one service is the primary care. In primary care, life-saving emergency services. And what are the other services that primary care physician or MDGP can provide?
Yeah, primary care service provider we are the head-to-toe doctor, and from child to the elderly, dying people, or the people who are suffering from the critical or long-term diseases, or we can say the palliative care. So from newborn to palliative care, we are focused on those things, which includes the from general to emergency to geriatric. So we are trained in those things, and we don't need sophisticated investigation for minor illness. But when we are working in the village, we don't want MRI to diagnose the small things. So our traditional taking histories, doing examining the patient is still working and is still a perfect thing. So for Nepalese, our economy cannot handle those kind of investigations. So for that one, we are trained on those things from child to the elderly. So we cover all the aspect of life, including the mental health.
Okay. So if we talk about the quality of health services, particularly the medical services, let's say the curative services, then if we talk about the quality of curative services, then we have to consider the category of different health specialists, like primary care specialist or GP, MDGP, whatever we call here. And then we talk about the organist specialist also. We have many specialties like ENT, eye, thoracic surgery and nephrology, whatnot. There are many specialists also. So having said this, we have different categories of health service providers, right? So if you want to talk about the quality of health services, then one very important topic comes in, that is the health insurance. Right? So if you have health insurance, then there is no overtake also, because government will say that okay, you have to go to the primary physician first, or family doctor first, or MDGP first. Then MDGP will take care of your illnesses. Then if there is complication, and in complicated cases that needs advanced care, like operation of the brain, operation of the heart, or whatever, then he or she can refer to the specialist, organist specialist. That way it will function. But in Nepal, you know what is the reality. In Nepal, there is no health insurance. And Dr. Sinji right now expressed that there is health insurance in many developed countries, including Japan. In Nepal, we don't have that. So what do you suggest that in this context? So health insurance should come in terms of improving the quality of medical care.
Yeah, before that, there should be good health education, about the health education in school level. So many diseases can be cured just by washing hand, drinking clean water, eating good, nicely clean food. So many things can be cured with those things also. And as you talk about insurance and referral system, again it comes under the education. So media people, we talk in the medias should educate people. Just having a headache, you don't need to go to the neurosurgeon or neurologist. So you find the people who provide primary care in your area. Actually, primary care services are not only doctors, they are your friend, they are your guardians. So there should be a system that people will trust you, they will come to you, then if needed, that primary care physician will send to the needed place. And it will decrease the burden of those specialized people also. If simple headache, if you go to the neurosurgeon, then the other person who needed a neurosurgery, they won't have a time to get appointment with that doctor.
Yeah, absolutely.
So this is very important. The education is most important. So we have to teach people, because if you have money, people thinks like in Far West, if you have little bit of money, they rush to the Lucknow or Delhi.
For small injury.
Small things, minor things. And this is all due to the lack of education. And if we teach them, definitely we'll be succeed on that matter.
Once again, Dr. Singh, so in Japan, as we know that there is growing population, like elderly population, the number of elderly population, aging population are increasing every year. So what is the role of the primary care physicians, the journalists or family physician, in terms of providing quality care to the elderly people? Do you share with us? Would you like to
Sure.
share with us?
Before I go to that, I want to talk about the importance of health education in Japan as well. I think people in Japan needs the same kind of health education that Dr. Mishra just mentioned. You don't need to go to a neurosurgeon for a simple headache, but under the health insurance, it's so inexpensive. People do go to a neurosurgeon to get an MRI, whereas they really need to come to us, primary care doctors, for thorough history and examination. But because it is very accessible, because healthcare is so inexpensive, because of the health insurance, it is a bit problematic. So I would like to emphasize the role of health education. As far as the growing population in Japan, Japan is growing old very rapidly. For example, where I practice, about 43% of people in my town are over 65 years old. There are like only 2 or 3 babies born each month, whereas 10 older people die each month. As primary care physicians, but because it is very accessible, because healthcare is so inexpensive, because of the health insurance, it is a bit problematic. So I would like to emphasize the role of health education. As far as the growing population in Japan, Japan is growing old very rapidly. For example, where I practice, about 43% of people in my town are over 65 years old. There are like only 2 or 3 babies born each month, whereas 10 older people die each month. As primary care physicians, the brain gets older, so people tend to develop dementia, Alzheimer's disease or other kinds of dementia. Since psychiatrists or mental health specialists cannot take care of all the patients with dementia, we primary care doctors need to be able to make a diagnosis of patients with dementia and take care of patients with dementia, and perhaps take care of the behavioral problems of patients with dementia. And also aging population, aging patients, aging citizens develop other geriatric syndromes like osteoporosis, that's thin bones, or they tend to fall down and break their bones, or they develop incontinence. They develop incontinence of urine, incontinence of bowel motions, things like that. We also need to be adept in taking care of those problems. Also, we need to be very cognizant of costs, healthcare costs, because of the fact that the cost of healthcare is rising. We need to treat with more inexpensive medications, and we need to be aware of cost efficiency. The amount of healthcare expenditure in Japan is in rupees 34 trillion rupees.
Oh, that's a big
per
amount.
year.
Yeah.
In US dollars, 300 billion US dollars. That's a large amount. Also, there is a separate insurance called care insurance. For example, to hire people for household stuff, for cleaning the household, or for cooking, or maybe bathing, or to utilize a service called daycare. There's what we call care insurance.
Dr. Singh,
yes,
because of the time constraint,
yes.
So I would like to say a few words about the GP's role, primary care physician's role in terms of disaster, disaster management.
Yes, yes.
So would you share with us?
Yes.
Tsunami?
Yes, we had a big tsunami some 4 years ago. And what turned out was that not only, first of all, people with emergency medicine skills sort of swarmed to the site. But what turned out was that after only a few days, what people needed were chronic usual medical care. Like Dr. Mishra mentioned, general medical care, not like emergency services. They were under like PTSD, post-traumatic distress syndrome, things like that. So, and they needed all sorts of general medical care. So, in that sense, we primary care doctors have a large role in disaster medicine.
Okay. Thank you, Dr. Shinji, for sharing your experience.
Thank you.
And Dr. Bishu also. Thank you so much for sharing your experience. And then now we have to close here. दर्शकवृन्द आजको हाम्रो कार्यक्रम यही समाप्त गर्दैछौँ र आउने कार्यक्रममा फेरि हामी अर्को एकजना विशेषज्ञ पाहुनालाई लिएर उपस्थित हुनेछौँ। त्यति बेलाको लागि हामीलाई पनि बिदा दिनुहोस्। धन्यवाद। नमस्ते।